Today I'm going to talk about my clinical trial of the extensive frontal lobe BBB opening for patients with Alzheimer disease. We installed the BBB device in year 2011 and also installed low frequency device in year 2015. And until recently, I underwent total 415 cases of the MRG FUS lesioning and BBB opening. As you can see, most common procedures was the lesioning for essential tremor, but I also underwent the BBB opening for glioblastomas and Alzheimer disease like this. My team also confirmed the reversibility and safety issues of the BBB opening in rat and mouse model of the Alzheimer disease. And this is my first paper published in year 2018. And I also confirmed the hippocampal neurogenesis and improvement of cognitive function with the focal sound induced BBB opening, and also confirmed the increased delivery of the stem cell if we combined focal sound surgery. Most recently, I underwent the first BBB opening with aducanumab, and we confirmed that combined treatment of the first with aducanumab improved cognitive functions and also significantly reduced the amount of the amyloid plaque in the hippocampus in mouse model of the Alzheimer disease like this. This is the clinical trial for the Alzheimer disease, and as you know, the Sunnybrook published their first clinical trial of the BBB opening in less than 1 cubic centimeter in the frontal lobe like this. Because they were limited in the area of the BBB opening, they couldn't see any improvement of the cognition with these procedures. We are trying to open the extensive area in the frontal lobe to see any the changes of cognitions and any change of the amyloid plaque in the frontal lobe. We are trying to open the more than 20 cubic centimeters, and this is our inclusion criteria. We select the patients in the age in between 50 to 85, and we are trying to select a patient more than 18 MMSE scores, and also we confirmed the level of the Alzheimer disease with FTG and FUS PET, and also we also underwent the comprehensive cognitive battery for all of these patients. Most difficult things was we don't know what is the best interval and what is the optimal number of the BBB opening for this patient. In our first clinical trial for glioblastoma, we opened the BBB 6 times during the adjuvant TMB therapies. However, there's no clear guideline for the BBB opening for Alzheimer disease. In the animal studies, many researchers opened the BBB 1 or 2 weeks interval more than 5 to 10 times of the BBB opening. But I was worrying about the potential complications, especially because I was trying to open the extensive area in the frontal lobe. Another important thing was by the regulation of the using isotope from our governments. I only can do the pre and one post-operative amyloid PET for these patients. So we decided to open the BBB 2 times with 3-month interval. We recruited 5 patients, and all the 5 patients has the significant level of the Alzheimer's disease and has all kinds of the medication like this. And we open the BBB in the frontal lobe with 3 different level like this. And as you can see, there's a very strong gadolinium enhancement after the BBB opening. Very interestingly, all the patients showed transient improvement of the memory. Another very important thing was the patients showed the improvement of the MPI at the last follow-up. Another very interesting thing we noticed was that there was a clear reduction of the amyloid in the area of the BB opening. This is the before, and this is the after the 2 BB opening. You can see the change of the amyloid plaque in the frontal lobe. Based on this clinical trial, we are now undergoing the second clinical trial. And the second clinical trial, we had the support from the FUS Foundation in the States. And for this clinical trial, just want to add one additional BB opening with 2-month interval, and we just want to open the more extensive area in the frontal lobe. For the first clinical trial, we opened the 3 different levels in the frontal lobe, but for the second clinical trial, we are trying to open the 6 or 7 different levels in the frontal lobe, and so far we already treat the 4 patients. Another big advancement of the system is when I first underwent the BB opening for glioblastoma, we only can open the 1 cubic centimeter with 1 trial like this. However, for my recent second clinical trial, by using the sparse transducers, we don't need to move the transducers, and the procedures can be done very quick, not to lose any microbubble. Another important the advancement of the system is now we don't need to do hair shaving. This is my patient with Alzheimer's disease. As you can see, we didn't shave the hair of the patients, and the process can be done very comfortably by the patient and patient family. At this moment, we don't know that this BB opening alone can improve the patient's symptoms. Of course, if we combine antibodies, or if we can do more frequent BB opening, can show the benefit of the patients. But we don't know which type of antibody is the best, and we also don't know what is the optimal interval and the optimal number of the BB opening for the patient improvement. Also, we must understand the function of BBB with MRG FUS. But anyway, during our recent clinical trial, during my recent animal trial, we also confirmed that combined treatment of FUS with aducanumab increased neurogenesis in the hippocampus like this. Thus, there are a lot of things we need to clarify if we want to use this technique in clinics. Thank you.